And then there's two, I think, attendees.
I think you need to set this up before the meeting.
It was signed in and it logged me out. But I'll do it like maybe 5 or a couple.
Yeah, open it.
Right, you have something. Now, go back to the Zoom window, on the bottom, on the right, like, see Zoom, no, on the bottom, yes. I'll make it big, there you go. Thank you.
Are we good?
We're good.
You're reporting.
Yes, record.
Everyone is in, okay, I call the meeting to order. It is 7:45 with apologies for lateness due to technical difficulties.
Adequate notice of this meeting pursuant to the Open Public Meetings Act was posted on the bulletin board at City Hall, the city's webpage, distributed to the record, and filed in the office of the city clerk. Pledge of allegiance. Pledge allegiance to the flag of the United States of
United
America,
States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Do you mind just turning it up a little bit for Brian?
Oh,
And just slide it over a bit, thank you.
Moving on to item 2, items for approval, which is the board's consent agenda. We'll bundle items 2A through 2D for approval, which includes the minutes of the May 14, 2025 meeting, revenues of $33,253 for May 2025,
so
expenditures.
do they just have to do a roll call?
I need a roll call. please.
Oh,
Ms. Bostic,
Present.
Ms. Davis,
Present.
Dr. Sadler,
Present.
Dr. Sofer,
Present.
Dr. Solomon.
Okay. You can continue.
all right. Now moving on to item 2. Items for approval. The board's consent agenda will bundle items 2A through 2D for approval, which includes the minutes of the May 14, 2025 meeting, revenues of $33,253 for May 2025, expenditures of $10,066.09 for May 2025, and employee reports for May 2025. And we'll need a motion to approve the set.
Second. Ms. Bostic,
Yes.
Ms. Davis,
Yes.
Dr. Sadler,
Yes.
Dr. Sofer,
Yes.
Dr. Solomon.
Yes.
Item 2E, retail licenses for May 2025. Is there anything about these licenses that should be made aware of?
No, all these establishments are in compliance, including having paid the late fees.
Moving on to reports, board liaison
Need a
reports.
vote.
Oh, well. First and second.
Motion. Second.
Ms. Bostic,
Yes.
Ms. Davis,
Yes.
Dr. Sadler,
Yes.
Dr. Sofer,
Yes.
Dr. Solomon.
Moving on to item 3, board liaison reports. Are there any reports tonight from liaisons to the council?
Mr. Tenzer went to the meeting. And he said there wasn't, much to report.
Should I move on to item 4?
Yes. Yeah.
Committee reports. Are there any reports from any committees this evening?
Budget.
Go on.
Moving on to resolutions. I'll read the resolution into the record and the board will require a motion and a second before we roll call vote. Resolution R 25 08 reads, be it resolved that the Board of Health of the City of Englewood does hereby appoint Dr. Nancy Rothberg as CHC physician for a period of 6 months, commencing July 1st, 2025, at a rate of $400 per clinic session for the terms of the agreement with the Board of Health. This resolution shall be made part of the said agreement as Schedule D. You know, a motion and a second.
Motion.
Second.
Ms. Bostic?
Yes.
Ms. Davis?
Yes.
Dr. Sadler?
Yes.
Dr. Silver? Yes. Dr. Solomon?
Yes.
Moving on to old business, item number 6, communicable disease update. Is there any update from Ms. Baldwin?
Yes, I'm going to highlight sections of Jim's report first, which was on vector-borne disease surveillance. 2 additional mosquito pools tested positive for West Nile virus in the week 22 from Morris and Cape May counties. 9 mosquito pools have tested positive to date in 2025 in Bergen, Cape, Webster, Morris, and Warren counties. There were no human or animal cases of West Nile virus and no human, animal, or mosquito detections of Eastern equine encephalitis or Jamestown Canyon virus in 2025. The number of Lyme disease cases is consistent with seasonal trends, and the number of tick-related emergency department visits increased from the previous week and remains higher than last year average. Highest number of visits continues to be in the Central East region. Communicable diseases for COVID, we had 13 cases, 6 confirmed by PCR tests and 7 probable by antigen tests. 1 was in the age group of 5 to 18. 8 were in the 9 to 64 year age. 4 were 65 and older. There was 1 hospitalization and no deaths. The staff reported 1 Mpox clade 2 cases of exposures, and current viruses right now are parainfluenza, human metapneumovirus, and rhinovirus or enterovirus. That's it.
Moving on to item number 7, grants. Ms. Baldwin?
Okay, so we sent you a copy of the communication from NJ Acho that this is actually as a result of the lawsuit that was brought by several states against the federal government. And these grants stated, we will be able to include expenses from the time it was canceled. We do have to do quarterly report and now a modification to the Sustaining Public Health Infrastructure Grant, and they are due on Tuesday. One issue that we have is I don't have information from the and HR yet regarding salaries and benefits, whether they're going to remain at the level that was offered to them in order to keep them on staff, or whether they will be returned to their original salaries. So I did let them both know that I need this information by tomorrow because it does take time to do the modification. And one of the reasons this is important to know is if they're going to remain they're at now, then we would have additional money to purchase other items. Because the one grant, almost all of the money was expended on salaries and benefits. So that's where we are right now.
Deborah, I'm gonna ask, I'm gonna ask that you hold that thought, and when we get to closed session and discuss personnel, I have a question, okay?
Okay.
Thanks.
Item number 8, Lake Gourmet / Rent-A-Kitchen, Ms. Paul.
Ms. Lewis and I met with the owner and the manager of Lake Gourmet / Rent-A-Kitchen. It was my understanding that they had some questions about the ordinance as it was passed, but actually the owner presented to us some to the fees that were just adopted. I did tell him that, there wouldn't be any action taken at this meeting, but if you would review what he gave to us as his proposals, and then we can, discuss it further next month. See if you are in agreement with changing the ordinance that was just adopted or leave it as is.
Your new business, public health events and outreach, again, Ms. Paul.
Um, right now, the new things coming up are walk and talk with health providers. This is being organized by the infectious disease prepared generalist. There are sessions on weekends, one every other weekend, and one is on a Saturday and the other is on a Sunday, alternating. There are several topics already set up for discussion with providers taking these topics, and this is at Flat Rock Brook. The only other thing I have now that's up, there's a chronic disease self-management program that's being offered to residents, and it's a 6-week program.
Number 10, Ms. Baldwin, is there anything about temporary license?
Can I
On the
ask-
temporary, I'm sorry.
Deborah, can I ask you a question? For
Sure.
the chronic disease management program, are there gonna be like pre and post surveys conducted?
Yes,
Any-
well, let me
any
see,
certain
that one,
measurements? Sorry, go ahead.
I will ask the health educator to make sure that we get that. This is offered by the Center for Alcohol and Drug Resources and the Bergen County Health Department. And the Center for Alcohol and Drug Resources is always very cooperative with us, so I'm sure that they do that.
Okay,
I'll
Thank you.
make sure that we get it.
Is there any other business to discuss tonight?
I just want to go back to the temporary license for a minute. We have had an issue with vendors submitting applications for these community events very late. And it's causing a problem because the licenses have to be processed in the computer. Ms. Lewis is responsible for talking with each of them and making sure that they know what's required. She also has to do the inspection and schedule people to do the inspections if she's not available. One thing in particular that's a problem is the ordinance says that there should be a special event for events where they're organizing 5 or more food vendors, and that they're supposed to submit a list of all vendors 20 days before, and then submit all the applications at least 10 days before. So after we had the agenda meeting, I spoke to Ms. Lewis, who attended planning meetings, and I did tell her to please advise all those involved that are at the meeting that this is going to be enforced, because it really has not been. It's hard when we're having an event in Englewood and then, somebody from higher up comes back and says, well, this is an Englewood event. We don't want to leave anybody out, but it's causing a problem for the staff. Our best to enforce this ordinance.
Was there any issue when she raised it at the meeting?
I'm sorry?
Did anyone have a problem with her message when it was raised at the meeting regarding enforcement?
She has not been to one of these meetings since we met last week.
Oh, okay. So the plan is to bring it to the meeting.
Yes.
And how many events are scheduled, say, within the next 10 days?
Oh, my goodness.
So. I
They're
mean, there are a lot of
they're currently working on Juneteenth. They've got farmer's market going. As of last week, there were only 2 vendors for farmer's market, which is not good, but think of what else. Police department has the movie in the park coming up.
Fireworks are coming up.
Yeah, and then also, Englewood Market, night market.
Right.
I just think making sure we get the message out there and all the vendors and all the sponsors.
Yeah, I just signed off on the Caribbean Festival licenses.
Didn't that happen already on
Yeah,
Sunday?
On Sunday.
Yeah, okay.
Deborah, do we have
Uh.
like email listserv for all the previous vendors that we've had? To send out like a notice to like a reminder, like if you plan on attending any future events, the 20 days in advance at a minimum.
It's not the.
It's possible. I believe, let me look at the, I know you can send emails to the establishments. I'd have to see if I can pinpoint those who have temporary licenses. I think it can be done. Make a note on my,
It's also the coordinator for each event, because each event is supposed to have a coordinator.
okay, for example, night market. That's something that we know that there's an event coordinator. But is reluctant to take on the responsibility that she's supposed to do as far as the food licenses. So she sends everybody individually instead of collecting the licenses, collecting the money, and then submitting to us. And she doesn't submit the list to us of who these vendors are.
And everybody's sending at different times then, right?
I'm sorry, I've got, my internet is not good tonight, I'm sorry.
So in that case, everybody is sending their applications at different times for the same
Yeah,
event.
yeah, and it's pretty much the same thing with Juneteenth. He does a little better job with coordinating the event, but they still come in one at a time,
So
and many
maybe,
times they're late.
so maybe because we're taking on the heavy of the load, we kind of maybe have to put the protocol, and like you said, enforce it and let them know that if they're not in time, then they can't participate, whichever.
Yeah, I mean, that's the bottom line, but so far they've been paying late fees, but it's still causing, a hardship on the staff trying to get all the paperwork done.
But it sounds like the
Get
coordinator,
everybody scheduled to inspect them.
The other option is also, if they're coming in one by one, you tell them that they have to don't take the applications if they have to be submitted by a coordinator. We have to stop accepting it.
Right, and the coordinator has to have a hard stop date so that
Yeah.
they can get in. Otherwise, if they don't get the information from their vendor, the coordinator is just gonna have to forfeit that particular vendor from participating.
Just gonna have to coordinate. He or she will have to coordinate.
Do you think that the 20 days is a hardship for the vendors and coordinators? And would it be as much of a hardship if we cut that time period a little bit shorter for the department? That's the other question. Like if 20 days is a lot, people are really cutting it down to the wire last minute. and we moved it out to, let's say, 14 days, would that be enough time for the health department to activate, but give a little bit more leeway to the vendors and the organizers?
My opinion is that that would work, would not be too much of a problem moving it from 20 days to 14. I'm not sure why it would be a problem for the event coordinator to do the 20 days, because by that time, they should know who these vendors are going to be at their event, because these are big events.
Yeah, but I mean, I do say that.
14 days, I don't think it's a problem for me.
A lot of, sometimes they're like, oh, I'm so sorry, I still want to do it. 14 days gives enough time. Beyond that, I think if we're gonna sort of make a compromise or a change to the ordinance or whatever we're gonna consider moving forward, I think we absolutely have to be strict on enforcement. As much as it may hurt a little bit upfront, the only way to learn a lesson is to start enforcing the rule.
Somebody has to feel some
Yeah,
pain,
I agree.
so.
I just wanted to also add, sometimes they also, there's several, they mail the temporaries in. So it's not just even saying, no, we're receiving the mail and
It's coming through the
it's
mail.
coming through the mail all along.
Yeah,
Coming
yeah.
to the.
Well,
But they know how long it takes. to
No, but I'm
mail
just saying, like, we can also be like, okay.
it has to go into a
Deny,
pile. We don't
yeah,
process
deny,
it. That's
yeah.
all. We don't process it. It goes into a pile and the coordinator is contacted and say, we can't process it.
Mail is very slow.
It is. But we'll do that.
Uh,
I just have one question. If you were to change the 20 days, this is to submit a list to us, not all the applications, but submitting the list 14 days, would you also want to change having the applications 10 days before?
I think that's sure. I mean,
I think
I
the
think
list
10
in.
days is tight.
You gotta get the list in, I think. 14 days, list is in. If the name is not on the list, they're out.
No, but then what does the current one say? The list is 20 days and the fees are when?
The applications are supposed to be at least 10 days before.
Okay, so right, so we're not
This
changing.
is just for the special coordinator for these big events.
Yeah, then I would leave it the same. I don't think we need to change that. If it's already 10 days, I would leave it.
So is that money? Do you think it's money or you think it's just la-di-da because we didn't enforce it? What have they said it's, a financial hardship? Is it? Do we know what the problem is?
No, some of it, I think, is that whoever's coordinating the events doesn't want to be responsible for collecting the application, the fees.
So then we put a box around that and say we'll take it from the coordinator and then that rule changes.
But the coordinator has nothing to submit it to us, so.
Right.
Right, if they don't submit it, then we don't,
We don't
There's
collect
no-
anything,
there's also no vendors,
so.
because they don't have licenses.
Deborah, you said a coordinator is required for more than 5, what'd you say before? 5, right?
Yes, it's event coordinator recruits 5 or more retail food vendors for a temporary event and is responsible for submitting a vendor list at least 20 days prior to the event. We pre-screen the applications for potential issues of deficiency, and then the event coordinator is responsible for ensuring all the paperwork and applications have been submitted to the department at least 10 days before the event.
It is the way it is.
So then we're just talking enforcement.
So we have a lot of events that are more than 5 vendors.
Most of them are.
Yeah.
Most of them are more than.
You have-
Yeah, so obviously the ones that are upcoming, we can't really enforce that timeline since they're less than 20 days away right now. But I think that a strongly worded conversation has to happen with all these coordinators and anyone who's beyond that timeline, that's where the enforcement has to happen. Juneteenth is next week, right?
Yeah. I would say a special reminder needs to go out to
Mhm.
everyone. had participated last year, so they're aware of it.
A reminder with the statement about what will happen if you don't do it. Because, you know, reminders are good, but if there's no consequence, then it's just a letter.
Well, what is the consequence?
I guess if
They
you
don't
have to
have the
decide they don't get to do it, I guess.
Oh,
It'll probably be easier when I look in the system to send an email to individual vendors who have participated previously. I'm not sure whether it has in the record who the coordinator is. Because that's really the person that needs to have the conversation or the communication
Is there a
But-
license, that coordinator gets
with,
licensed?
sending it to the vendors.
Somewhere else in order to have it here in the city. So some organizer in the city has allowed them to do this.
Yeah,
So that coordinator has asked permission here in Englewood. So their name should be on some document.
Probably a
Yeah.
permit, a building permit.
Yeah.
Right.
Right. So that's all we need to contact them.
Yeah.
Event permits, that department, and this letter goes along with anything from the past year that had an event.
the city manager's assistant may have that, probably has that information. I'll see if I can get it.
Ms. Baldwin, is there any other business to discuss?
I do not have any other.
Moving on to public comment, the board will require a motion to open the floor to public comment. A second and a vote. Speakers have 5 minutes and must state their name and address.
And put on cameras.
You need the motion somewhere.
Sorry.
So
Ms.
moved.
Bostic,
Yes.
Ms. Davis,
Yes.
Ms. Rubin,
Yes.
Dr. Sadler,
Yes.
Dr. Sofer,
yes.
Dr. Sullivan.
Yes.
Is there any public comment to be made tonight? If there's no public discussion, the board will need a motion and a second to close the floor to public comment.
No one responded.
I asked to unmute and they didn't.
Motion, close public comment.
So,
Second.
Thank you. Ms. Bostic,
Yes.
Ms. Davis,
yes.
Ms. Rubin,
Yes.
Dr. Sadler,
Yes.
Dr. Sofer,
Yes.
Dr. Sullivan.
Yes.
And then I just have to turn off the